scope up.
जैसे आप
हाँ scope.
Mustafa, you're live on the.
Okay. So you know the case, middle-aged lady with a hysterectomy and incidentally found to have a dilated bile duct. She may have had pain initially, but now it's resolved. So asymptomatic, normal LFTs. So we're just checking the balloon. If you do use a balloon, then you want to make sure there's no air in it, because air will get in the way of your image. So they're just making sure that the air is gone. Okay. Just relax your बिल्कुल relax करें और फिर advance करें ऐसे. If in doubt, वापस बाहर ले आएं. Just come out. और मैं आपको एक चीज़ दिखाऊं. So you want to be relaxed, थोड़ा सा relax होके और फिर थोड़े से ज़्यादा flexion तकरीबन 90 degrees के साथ. And I'm going to have you do it, okay? तो यूँ करके, when you know that you're over the tongue, थोड़ा सा big wheel more towards you to advance it. And I'm getting no resistance. Now I'll be above the chords. फिर मैं extend करूँगा to go in. So I want you to try that. Go about 90 degrees, and then once you go over the tongue, then you can flex it even more. Flex it even more, and just gently advance. Now you can see the vocal cords. Ab extend your big wheel and advance the scope. Okay? Good. And then usually in this setting, balloon ऊपर हो रहा है. आप बटन का मकसद नहीं है कोई.
एयर सक करें.
हाँ, एयर सारी सक करें. balloon होना नहीं चाहिए without air डालें ही ना. Just advance the scope. Keep advancing till you're past the G junction. ठीक है. तो अभी भी esophagus है. So आप once you're in the stomach, you can relax. ठीक है, that's it. अब first thing you want to do is suction all the water out. हाँ जी. ठीक है. अब यहाँ से when you see the tip of the liver, थोड़ा सा advance करें, just a tiny bit more, right there. Now if you want to do what Dr. Hassan was showing and Dr. Ghas, so एक दो चीज़ें मैंने आपको दिखानी है. So I'm going to take over from you. आपका हाथ इस वक्त है यहाँ पे और यहाँ पे. What you want to do is bring your right hand behind that and work your left arm. Okay, with my left arm, you can see, just look at the EUS image. Look at the liver right now. All I'm doing is this, and it's taking me to the aorta, right? Or if you look at the scope, in 90 degrees from here to here, I can get to aorta. If you're too tight here, then you're doing this, and you're going to have a hard time moving things. So it's okay to step back a bit, grab this with your left hand, and then just spin around like this. So this shoulder needs to be loosened up. Okay? There you go. See, just like that, you went all the way from liver, aorta, celiac, SMA, crust of the diaphragm, big wheel slightly towards you. Ye kidney aa gayi. If you go counter from the kidney, so go back the other way, and you may have to pull back a tiny bit. Thoda sa, and big wheel towards you, and go counter, more counter. So go this way, counter will be this way. So you may see the adrenal here. But what I really want you to do is just focus on practicing this movement. ताकि आपको अंदाज़ा हो बैक के फ्लूइडिटी ऑफ मूवमेंट क्या होती है यूएस में, राइट? सो वो IVC थी बाय द वे. इफ यू वांट टू नो, लाइक इफ यू गो क्लॉकवाइज, दिस इज IVC. Okay, middle hepatic IVC. So you can push forward a tiny bit. If you see IVC, you genuinely want to push forward a tiny bit. Relax your big wheel. If you're pushing on the big wheel, then you'll hit resistance. So relax your big wheel. Go clockwise. There you go. And that's the aorta coming all. Keep going, actually, keep going. There. So that's your aorta. 1 second freeze करें. Let me actually इसको हटा दें. So just for recognition purposes, it's good to know what else is around. So ये तो aorta हो गया, and that's the celiac coming off. Here behind the aorta, you can actually see these. This is the spinal. This is the vertebrae. So this is one vertebra and this is another vertebra, and this is the space between vertebrae. Okay? So you just, as you see, do more and more, you can recognize these structures. Now when you're at the celiac, I want you to just slow down. So keep spinning clockwise a bit, right there. So here. So right here is your aorta. The other thing that you need to know about, or the celiac, is the crust of the diaphragm. The crust of the left diaphragm will usually come down this dark structure here. Okay, muscle is hypoechoic. So ये सारी चीजें जो हैं, you want to sort of keep an eye on. Pattern recognition is one of the key things. So now keep the celiac in view. So there you go. Now that's where, a bit more clockwise. You'll go back the other way. Big wheel thoda sa apni taraf towards you. That's good. Now push forward a tiny bit and keep that aorta in view. Try the other way. Keep going there. Keep going counter. Okay, go clockwise. There. So there was your celiac. Now if you push forward to follow the celiac artery. There you go. Celiac SMA. And you just relax your big wheel a tiny bit. There you go, and advance. That's beautiful. So that is your celiac SMA. And the celiac should branch off. Advance your scope a tiny bit and try and maintain the view of the celiac. So spin to the counterclockwise maybe. So to the left. Yeah, keep that view and keep advancing. Keep that vessel in view. So go the other way. Not this one, the other one. Go counterclockwise. There. Keep that vessel in view. So keep going counterclockwise. Keep going. Other way. There. So that is going to turn into the splenic, and that's your pancreas coming into view. So if you keep relaxing your big wheel, remember if something is to the left of your probe, relax your big wheel and push forward, and that will bring this down. So relax your big wheel and advance your scope. And now you're bringing yourself onto the pancreas. You see that? So now, yeah, so this is exactly it. And so now you have your pancreatic duct in view. Now you're going too far past it, so you have to pull back a bit. And now, gentle clockwise, again, this hand should just ideally come back a bit here. And just bilkul relax, okay? Just stay relaxed, and using your left shoulder, go clockwise. There you go. And now you're following the pancreatic duct towards the tail. Now this is getting pinched, so relax your big wheel. If you relax your big wheel, you see how your PD was getting compressed. Now you relaxed it. Now you can, now because it's going off to your right, you have to pull the probe back. There you go. And now you follow it towards, keep going clockwise and you follow it towards the tail. Keep going clockwise, and as you go clockwise, you have to pull back. There you go. That's your duct going towards the tail. Good. Keep, you may have to go slight big wheel towards you as you come towards the tail. Okay, too much. So now pull back the scope again. Keep pulling back because it's behind you. And now you can keep going clockwise. And keep pulling back because it's still to your right. If something's to your right, you have to pull towards you. Keep going clockwise. That's your pancreas. It's going to fade away from you in a second. So big wheel towards you to keep it in view. More towards you, more. And we're losing it here, but that's the pancreas right here. This is still pancreas. That's better. Now you have a better view of it. This structure here is the pancreas. Keep going clockwise. And now it's so big wheel more towards you, so you don't lose it. In the tail end, you have to go really hard towards you. Keep going down towards you. Good. And this is the tip of the spleen coming up. So your pancreas is ending here. So you followed it all the way from the body. And now, to do the reversal of that, now you're going to go counterclockwise. And you may have to relax your big wheel a bit if necessary, like the PD gets compressed. Okay, good. Keep. There you go. Very nice. Keep going counterclockwise. Keep going counter. Keep going counter. Now it's going ahead of you, so you have to push forward a bit to chase it and go counter. Good. Keep going counter. And it's going to dip down towards the portal vein, right there. So keep going counter and keep pushing forward. Now it's going to prevent it from going away from you, you have to bring your big wheel towards you. Not too much. That was a lot. So midway. और उसको बस try and maintain it in view and keep going counter. It's a multi-step movement. You have to go counter, big wheel towards you and push the scope forward. सब चीज़ें इकट्ठे करनी होती हैं. So go ahead, that's it. And it's going to cross now big wheel towards you as it goes down and push forward as well. So push forward, big wheel towards you and go counter. And there the PD goes behind the portal vein. Keep going counter. Keep going counter. There's the PD. So pull back a tiny bit. There you go. Big wheel towards you. That's it. Keep going. And now it's crossing over. Big wheel towards you. And go counter. Keep going counter. Maybe pull back a tiny bit. Pull back a bit. But keep the big wheel towards you. And spin around. The other way. But usually there. Whatever you just did, keep doing that, and you'll see the PD go down this way now. Keep going, keep going. So now it's going towards the uncinate. Now if you go back the other way for a second, keep it in view, you'll see a bit of the bile duct down here. And to prove that it's the bile duct, we can do Doppler. Sorry, wrong one. And this bottom one is the bile duct. So big wheel towards you. There you go. This is bile duct. And that's pancreas. So you know that you're going towards the head, right? Now if you go clockwise again, you'll follow the PD, go behind the portal and back towards
left of the patient.
towards the patient's left, exactly. Sorry, bead button. Thank you. So now keep going clockwise. Keep going clockwise and relax. You see how there's tension on this? So just relax your big wheel. There you go. Now you relax it and the tension goes away. And now the PD's, what are you going to do? Pull back, exactly. Pull back, keep pulling it back, keep pulling it back. Go clockwise. And it's getting behind you, so you have to keep pulling back. You have to try and maintain it below your probe, right there. So you keep pulling back, big wheel towards you a bit, towards the tail, and keep going clockwise. It's still behind you, so you have to pull back some more. And keep big wheeling towards you. Because the pancreas doesn't go like this, it goes up towards the left. That's why you have to big wheel towards you to chase it towards the spleen. Exactly. Keep coming back, keep coming back, keep coming back. Now big wheel towards you and pull back for a second. Pull back. Good. So that's going to be, I think, your spleen. So now if you go counterclockwise here, that's your kidney coming into view. So keep pulling back. Keep pulling back. I want to see the top end of the kidney. Keep pulling back. Big wheel towards you. That's it. And now go counterclockwise. That's it. Keep going counter. Keep going counter. Keep going. Keep going. And that's your left adrenal gland. That's the seagull sign. Right? There's your left adrenal. And if you keep going counterclockwise from here, keep going, keep going, keep going, keep going. It's okay, keep going counter. There's your aorta and there's your celiac. right? So you can do these both directions. You can start from celiac and go towards pancreas, go towards the neck, and then you can come back from pancreas and do it. ये तो आपको आ गया. So if you want to try this one more time, then we'll go to the bulb. Okay. So there's your celiac. Now when you have, from here, if you see, this is, remember those are your splenic vessels. So इसमें थोड़ा recognition ज़रूरी होती है. So relax your big wheel. And this, remember, you see, as soon as you see the PD here, now you know the PD is ahead of you. So you just have to relax your big wheel, push forward, and you're on the pancreas. See, and from here you can go counter towards the head, clockwise towards the, yeah, and again, the tendency to go is to go towards the mouth. मैं encourage करूँगा कि step back a bit and just, and a lot of it's this left shoulder. ठीक है? Good. Now, if you want, you can go to the bulb. So endoscopically, you can head.
CPD के लिए क्या देखना
तो यहाँ से या कि बल्ब से?
आप बल्ब से देखिए
हाँ हाँ बल्ब से. तो अब फिर आप endoscopically देख लें. Just for that, you go to the bulb and you'll start from there.
अब दूँ तो बैलून इसका फूल जाता है
बलून खुद से फूल रहा है तो बटन का मसला होता है यूजुअली. ये खुद से फूल रहा है. जो आपका एंडोस सक्शन वाला बटन ठीक है.
सेक्शन वाला भी सही दोनों चाहिए
हाँ अच्छा आपने किया.
कर देता हूँ
हाँ चलो चेंज कर
अब देख लीजिएगा इसमें होना
दिया.
नहीं
हाँ होना तो नहीं चाहिए. पाइलोरस आइडेंटिफाई कर अपना पाइलोरिक चैनल. गुड. कीप एडवांसिंग.
सर बैलून इन्फ्लेट करने के लिए हमें यहाँ से कुछ करना पड़ता है या इसको दबाना पड़ता है?
हाँ तो
वाटर के लिए
वो
तो
जो होते करते कि
हाँ।
हाफ इज जस्ट, अगर आधा दबाएंगे तो इट्स जस्ट एयर. फुल
full
करेंगे
दबाएंगे तो जैसे पानी आता है या
वो
RCP
वो
में
बलून में चला जाएगा. तो इसका थोड़ा सा यू हैव टू गो बिग विल
Sunset
टुवर्ड्स यू. बिल्कुल. दैट्स इट. नाउ यू आर इन. तो अब आप थोड़ा सा बस और आगे करें एंड यूजुअली स्टॉप राइट देयर. हाँ जी अल्ट्रासाउंड लें. तो अभी तो वी डोंट हैव एनी बिकॉज आपका प्रोब जो है इट्स नॉट टचिंग द वॉल. So just push forward a bit. Keep pushing forward. Keep pushing forward. और ये जैसे आपने push किया तो नज़र आना शुरू हो गया. Now, right now we're not seeing anything, right? जो triad में the biggest structure is the portal vein. You have the bile duct, portal vein and hepatic artery. So if you find the portal vein, then you can orient yourself. Usually in these situations, what you first thing you have to do is big wheel towards you and go counterclockwise. To see and go counterclockwise and try and maintain this, get rid of the air. So the two ways to get rid of air is either that section or sometimes you pull up the balloon, right? So now see if you can go counterclockwise. Relax. It's a mixture of pushing forward and relaxing your big wheel to maintain and that view good, and then keep going counterclockwise. Keep going counter if you can. तो उसमें यह है कि टॉर्क नहीं करना. Your left arm has to do the work. ये देखिए you. You see this? Your left arm is going counterclockwise. And remember earlier too I said your hand can go towards the feet. That's okay. But you can't have tension. So here now you can see a part of the gallbladder. So one other, now if you do big wheel towards you, you'll have the gallbladder more in view. Or secondly, what you can do is, if you want to see if there's sludge or stones in there, stay on the gallbladder for a second. So, yeah, exactly. Go the other way, maybe. Thoda sa, I think scope wo out of position ho gaya tha. So now we're back out again in the pylorus. So go forward. Okay, now this time your view is slightly different. Now we can see structures that may be potentially a duct. But they're all vessels. So again, relax your big wheel. Keep relaxing the big wheel and keep going counter. Keep going counter. And again, left shoulder se karna hai. Now we're seeing another structure. Let's see if that's a duct or not. Still a vessel, right? Keep going counter. Keep going counter. Okay, stay there for a second. All vessels. But these are recognizable structures. I think that may be the portal vein coming into view. So if you think that's a portal vein, try and maintain this view, relax your big wheel, and keep going counter on it. Keep going counter. And now we're going to see if we see any ductal structure. We still haven't seen anything. So uska ye hota hai ki, let me just try one thing here. This bulb view is sometimes hard to teach, but basically we may be too far down. You see where we are? What you really want to target is the apex of the bulb. So I'm going to actually pull back a bit because we're pretty far. Go back into the pyloric channel and stop right there. Suction and really drop my hand this way. And I'm extending my big wheel and my hand is going towards my feet. So I pushed forward a bit with my hand dropped, and now I can see my portal vessel coming into view. So if I do flow here, I can see my portal vessels, and this is where I'm going to try and look for the bile duct. So I'm going to keep that in view and see if I can find my bile duct here somewhere. This is the portal vein. So this is my portal vein right there. That's my bile duct. Now in this situation, because it's unstable of a position, you may actually want to put the balloon up to see if that helps you stabilize, because now you found the bile duct, you can then try and keep it in view and follow it down. So unlike other situations we've had today, this is not an easy bile duct to identify, but now once you have it, you want to follow it towards the head and then from there back towards the liver. But I have to say it's not an easy bile duct to maintain in view. So if this is my bile duct, I have to recognize which one it is. It's right there. In this area, it's about, this is not all the way to the liver, but it's about 9.8, right? But this is a tricky one. So it goes to show not all bile ducts are going to be easy. Secondly, once the gallbladder is removed, it's easier to find. So you just keep trying, but the key was to find the portal vein. Once I had the portal vein in view, then I could look for it around there. So it's going over there. But ye mushkil wala hai, but I want you to try this again. So we'll come back to the pylorus and try again from here to see if you can find it. Okay. Okay. So now actually you have a good view because you have the PD. So this is where the recognition part comes in, because cursor. So you have the pancreatic duct there, which means if you go this is pancreas. So if you go clockwise, there's your bile duct coming into view, right? So now you have this view, so you don't want to lose it because you found something. So try and follow it towards the head. So because it's to your left, push forward a tiny bit on the scope and relax your big wheel to bring it more underneath you, and go clockwise. Keep going clockwise. There's your bile duct. And here we kind of lose it a bit, but the distal bile duct looks okay to us. If you go counter, we get a bit of gallbladder, but keep that in view if possible. So push the scope forward and relax your big wheel. Keep the scope forward. And just keep going counter for a second. This is not the easiest bile duct. So keep going counter. Keep going counter and drop your left hand. Keep going counter. इसको और नीचे आने दो. That's it. And we may not be deep enough. थोड़ा सा push forward. Relax your big wheel. Now big wheel towards you. There you go. Okay, big wheel towards you and go clockwise. Keep going clockwise. Keep going clockwise. Yeah, there's a bit of liver there. So कई दफ़ा ये होता है कि you don't get a very optimal view. You have to decide, okay, in the interest of time, did I get enough of a view to move forward and go to the second portion? Should I try from the second portion and pull back? What I want you to do is find it one more time. Yeah, see, you just subtle movements here and there and you're finding it. So go forward here a bit, relax your big wheel. You have the gallbladder will also hide your bile duct. Now go clockwise. Okay, that takes you to kidney, so we have to go counterclockwise. Keep going counter, keep going counter. And push forward, keep pushing forward, keep going counter. Okay, here now we're getting the portal vein again, right there. So do the opposite of what you just did. Right there, that's your pancreatic duct. So go back to it. Okay, now push forward, keeping this in view. Big wheel towards you. Okay, push forward. Okay, we'll lose it. That's the problem.
Dr. Mustafa,
Yes, right there.
can I ask a question?
Yes.
So we are getting a difficulty to get the CBD. So is it a routine thing, or it's due to the distended gallbladder, or some anatomical variant?
The question is, why are we struggling to find the bile duct? I think it's, all patients' anatomy is different. The first patient also had a dilated duct and we could find it very easily. And this one is harder than usual, but you just have to accept it that sometimes I'm only going to get a suboptimal view like this. That's the best I can do right now. And that actually goes into the liver from there. So we are seeing most of the bile duct. It's just not the classic rounded view that we're used to seeing. We're seeing more of a linear view here.
Yeah.
But it's extremely unstable. So I'm constantly having to move my hand. My left hand is constantly having to do something to keep it in view. And that's partly simply because of experience. When you're early on in your career, it's easy to get lost on these things. But here now, this is the best view I can get from the bulb. I was really hoping Afan could find this view, so I'm going to leave it here and hand it to you right about here. I'm memorizing this vascular view, and right there is the bile duct. See if you can grab it from here. And so don't pull back, push forward. Good. And then go clockwise. Go big wheel towards you, slightly clockwise. Big wheel towards you. Their bile duct's going to come to your right. So go clockwise. Keep going clockwise. Agar nahi hota hai, then we'll go to the second portion.
They depleted, I think. Okay. Dr. Khalid, a question
Right
to you.
here.
Is there a role of patient positioning like other procedure of colonoscopy and
the second portion
we do the
there's part of it.
positioning of patients in different
हाँ,
manners.
so आप
Is there a
just
role in
like
EUS?
you do in ERCP. So यहाँ से just go small wheel to the right, big wheel towards you, and pull back.
We
Then you
have
just
to shorten like ES.
shorten like ERCP, exactly. But don't lock it. Don't lock. Just shorten like ERCP. Big wheel towards you. थोड़ा सा आगे जाओ. कोई नहीं. Try again. Just do like what you normally would do in an ERCP. So big wheel towards you, right? Get over this. Big wheel towards you, small wheel to the right, right? Just be gentle, okay? And now big wheel towards you and pull back. Pull back. Right? And big wheel towards you. Sorry, scope towards you. Pull the scope now. Good. That's it. Okay. And अब आप endo बड़ा कर दें एक second. You're going to look for the papilla endoscopically. Because what if there's an ampullary lesion, right? So just gently, wheels should be unlocked, right? Are they unlocked? Okay, good. Now look for your papilla. Pull back a tiny bit. Okay, now you're past the papilla. So you're going to pull back and you're going to look for the major papilla here. Pull back. Pull back. That's good. Keep coming back. It's probably going to come to your right by the looks of it, right? So keep pulling back. Keep pulling back. Keep pulling back. It's going to come right up there. Keep pulling back. Right there. So you want to, I will usually take a picture of it to prove that the papilla is normal in these patients. That's your papilla, right? So now your main goal is to find those two ducts, right? So my recommendation is exactly how you're standing, and usually go down like this a bit, and big, so small, so push forward. Hold it, support it from here. Big wheel towards you, and big wheel towards you. Okay, good. Big wheel towards you, ताकि mucus, you want to make contact. गिरेगा तो वापस चले जाएंगे ना. That's the whole point. So big wheel towards you. Yeah, so there you go. You have to do big wheel, otherwise you will not see your ultrasound image. Otherwise air gets in the way. Ultrasound बड़ा कर दें. Okay, big wheel towards you. That's it. And maintain that. Now keep pulling the scope back. थोड़ा सा pull back. And there's your ducts right away actually. So what you do is you go clockwise. For kidney, so यहाँ से you have to go clockwise. Keep going clockwise, keep going, and that's your duct right there. See, those are your two ducts. Yeah, CBD and bile duct. So keep going clockwise for a minute. So the way you do that is bend this and push forward like this. Keep pushing forward. That's your unsnit, okay? Unsnit, counter, flow band. There's a bile duct, so don't pull back too much.
Slow up.
There's your ventral pancreas, there's your PD, and there's your bile duct. Okay? मैं आपको ज़रा अपना भी करके दिखाता हूँ how I do this, but that's basically you found it, right? उसका तरीका ये होता है कि those are your two ducts. That's your PD, that's your distal bile duct. But that's essentially, this is exactly how I want you to do it, but it's just a matter of getting comfortable. You basically find your second portion. So let me go back in. Tight है, mouth के अंदर tight है इनका थोड़ा सा. छोटा है मुंह. नहीं सही है. Okay. So we're going to try and reduce here. Find my papilla, right? आप सही के आपका यूं था, you were high up. मेरा ये होता है कि I bring it down like this, so it's a U-turn. Okay? And then I have my endoscopic view on the papilla. My feet are pointing at 2 o'clock. And now big wheel is towards me. And if I go all the way clockwise, it's going to be uncinate. And then I gently start pulling back and going counter. And right there, I can see the two ducts. But here, again, this is not, unlike the first case that I was showing it in, this is less stable. So you are getting these views too, but what we're interested in is seeing is there anything at the bottom of the duct, right? That's because that's where the question was, could there be blockage or not? So here, pani dobara de dein, it's around 60 cc of air. I'm not seeing anything, but in order to get rid of this air artifact, I'm going to put the balloon up a bit, and then I'm going to put some water in there. Dal do? And now we'll see if we can see the distal duct. Right there. It just comes out, in and out, but there's no real obstruction or stone that I can see. Right there you can see the this here is going to be your MP going across like this. And so this is the PD, the bile duct is going to be above it, and we're looking for any abnormality in this region. But I just fell back again. But I didn't see anything. So this stomach exam was very easy, but the duodenal exam is not so easy. So if we need to stop, we can stop. लेकिन ये है कि we can just switch. ठीक है. So but normal bile duct, you did very well. You did excellent. ठीक है. चले. Okay. No obvious pathology. I think normal duct, like 10 millimeters, and I didn't see. एक second में gallbladder दोबारा देखूं, but I did not see any stones in the gallbladder. अब जब चाहिए gallbladder तो मिल नहीं रहा. But anyway, the gallbladder was fine. A normal pancreas, 10 mm CBD. Smooth, no stricture, no stone, no mass. इनके वो throat में वैसे तो tight है इसको. तो लेकिन you did well. बस ये है कि जो ना left